Bismillahirrahmanirrahim. Assalamu alaikum. Today we're going to talk about the chloramphenicol. Chloramphenicol is a broad-spectrum bacteriostatic antibiotic. It is a protein synthesis inhibitor. It was the first drug to be used both systemically and orally. It was first isolated in the year 1947 from a soil actinomycete, Streptomyces venezuelae. Its clinical use began in 1949 under the trade name of chlormycetin. Later, it was produced synthetically on a large scale. But by the decade of 1950s, it became known that the drug can cause serious and fatal human blood disorders. In 1952, a less dangerous derivative, Thiamphenicol, was produced. So this is the structure of chloramphenicol. Here we have the paranitrophenyl ring. This is propendiol and dichloroacetamide. This is the structure of thiamphenicol. So thiamphenicol differs from its parent compound, the chloramphenicol, in that the paranitro group here, the paranitro group in the benzene ring is replaced with this sulfomethyl group. And this makes thiamphenicol safer as compared to the chloramphenicol. Spectrum of activity. Chloramphenicol are broad spectrum drugs, and so both gram-positive and gram-negative bacteria lie in their spectrum. Along with these gram-positive and gram-negative bacteria, these chloramphenicol can also act upon, they're also active against intracellular bacteria like Chlamydia and Rickettsia. These intracellular bacteria, they can cause a variety of infections, including trachoma. Trachoma is basically a disease of the eye caused by infection with Chlamydia trachomatis. They can cause psittacosis. Chlamydia psittaceae is a type of bacteria, and it often infects birds, but less rarely these bacteria can infect people, and so they can cause a disease called psittacosis. And then the rickettsia can cause typhus fever. Typhus fever is a group of diseases caused by bacteria, these rickettsias, and they are spread to human by fleas or by lice. So not only the gram-positive and the gram-negative bacteria lie in their spectrum, in the spectrum of chloramphenicol, but their spectrum also extends to these intracellular bacteria. But these chlorampphenicols, they are ineffective. They show poor activity rather against these Pseudomonas aeruginosa. Let's talk about the mode of action. Chloramphenicol inhibits protein synthesis by binding to the 50S ribosomal subunit. And so once they bind to the 50S ribosomal subunit, they inhibit the enzyme peptidyl transferase. So peptidyl transferase is an enzyme that links amino acids in the growing peptide chain. Here we can see a ribosome, and here we can see the peptide chain. So tRNAs, they come and obviously they bring the amino acids, and these amino acids are linked one by one, making a peptide chain with the help of this enzyme, the peptidyl transferase. And so chloramphenicol, they inhibit the action of this enzyme, the peptidyl transferases. Obviously, if the action of peptidyl transferase is inhibited, there will be no chain elongation, and so the bacterial growth will come to a halt. So these chlorampphenicols, they are reversible. This action is reversible, and so thus the chloramphenicol is a bacteriostatic agent. Certain resistant strains of bacteria have acquired certain genes, and so they have developed resistance against these chlorampphenicols. The first mechanism of resistance by which the resistant genes have protected themselves is the inactivation of the drug. So the resistant strains have an enzyme, chloramphenicol acetyl transferase, and this enzyme, it causes acetylation of the chloramphenicol. So once the drug is altered, once there is acetylation of the chloramphenicol, it results in inactivation of this drug. Since acetylated derivatives of the drug are unable to bind to the bacterial 50S ribosomal subunit. The affinity of the drug, of these acetylated derivatives of the drug, reduces with its target site, and so the drug is no longer able to bind to the target site. And obviously, if the drug cannot bind to the 50S ribosomal subunit, it will no longer be able to inhibit the activity of peptidyl transferases, and so there will be no protein synthesis inhibition, thus the drug will become inactive. The second mechanism of resistance which the bacteria have acquired is the efflux pumps. So these efflux pumps are located in the outer membrane of the gram-negative bacteria, and they are responsible for pumping the drug out of the cell. Thus, obviously, the drug will no longer get accumulated inside the cell, and obviously, if the drug can not get accumulated in the cell, it'll not reach the target site, and so the drug will become inactive. Adverse effects. There are certain adverse effects which are produced by these chloramphenicols. The first adverse effect which may be experienced with the use of these chloramphenicols is the GIT disturbances. Chloramphenicol may cause glossitis. Glossitis is basically the inflammation of the tongue, and this glossitis is associated with the overgrowth of Candida albicans. So if these chloramphenicols are used over a week, if the course of treatment exceeds a week, the normal flora of the body would be suppressed. Since these drugs are broad spectrum drugs, they will suppress the normal flora. Thus, the opportunistic pathogens like Candida albicans will overgrow, and the overgrowth of these Candida albicans result in glossitis, the inflammation of the tongue. Other than glossitis, some effects like stomatitis, inflamed or a sore mouth, nausea, vomiting, and diarrhea may also occur rarely. These effects can rarely occur. Then these chloramphenicol can cause bone marrow suppression. This bone marrow suppression may be dose related reversible, or it may be non-dose related irreversible. So if this suppression is of the second type, if it is non-dose related irreversible suppression, this is obviously more serious form, and this may lead to aplastic anemia. Aplastic anemia is the deficiency of the red blood cells due to bone marrow disorder. The chloramphenicol may cause hypersensitivity, reactions like fever, rash, urticaria. Urticaria is also known as hives, and it is an itchy rash. It may cause angioedema. Angioedema is the swelling underneath the skin. It may lead to anaphylaxis. Anaphylaxis is a life-threatening reaction which is triggered as a result of maybe an allergy. Gray baby syndrome is a specific side effect caused by these chloramphenicols. It is a life-threatening syndrome which occurs in infants basically, and infants obviously do not have fully functional liver enzymes which are responsible for metabolizing the drug. So if the drug does not get metabolized, there will be insufficient excretion through the kidneys, and if the drug does not get sufficiently excreted out of the body, it will lead to accumulation of the drug. The drug will get accumulated, and this accumulation of the drug can cause vomiting, flaccidity is basically a type of paralysis in which muscles become soft. It may lead to hypothermia, very dangerously low body temperature. When the body loses heat faster than it can produce heat. This gray baby syndrome may be characterized basically by cyanosis. Cyanosis is the bluish coloration of the skin because of the shortage of oxygen in the blood. It may lead to shock, low blood flow, a life-threatening condition that occurs when there is not enough blood flow, and circulatory collapse. Finally, the chloramphenicol, one of the adverse effects of chloramphenicol may be central nervous disturbances. This CNS disturbance may lead to headache, mild depression, mental confusion, and optic and peripheral neuritis. So this was all about the chloramphenicol. Thank you very much.